I mentioned the governor, Governor Greg Abbott. Governor, last week we had an opportunity to speak, and I really do appreciate your time again on CBS 11 News at 6. A week ago, we weren't really, I guess, ready to talk reopening, but my understanding is you are inching closer and closer to finalizing a plan to reopen the state of Texas for business. What are you willing to share with us tonight as far as what that looks like?
The announcement will come on Friday. It will be by way of executive orders that will talk about what that pathway is. But first, it will create the design of a team that we've put together that's been working very hard for a long time now to get us to this point. Second thing that it will do, it will emphasize the importance of public safety, the ability to continue to contain the coronavirus. It will do us no good to open up businesses, to get back to work and get back to normal if doing so causes the coronavirus to increase the spread. People in the Dallas area have worked so hard and done so well to contain the spread. The last thing we can do is to reignite that spread. The third thing is we will talk about the correct strategies that can be used for certain businesses to begin that process of reopening. What I mean by correct strategies, each type of business will have a different type of best safe practices to prevent the spread of the coronavirus. And we will have a team of experts who will assist in trying to set those standards.
Governor, let me ask you this, because you bring up testing, and I don't think anybody would certainly argue the ultimate goal on that. Recent reporting, though, says we're nearly dead last in the state of Texas as far as testing for COVID-19. When we look at the country, Dallas County said and went on record saying they don't have the supplies they need to max out testing. Private labs we've heard from report the number of tests they've processed in the last week has dropped. With that information, are you concerned with what you're hearing on the testing front?
Well, because I know the facts, I'm not concerned at all. First, as far as raw number is concerned, we rank like 7th in the nation in the number of tests. Only states that have far more deaths than Texas have tested more people. But put that aside. What I know from what I've been working on today and yesterday, the day before, is the number of tests that are coming, including that are coming to the Dallas area in particular. Announcements that cannot yet be made. But what I know is as we march forward toward the process of opening Texas up for business, one thing that it will require is even greater testing than what we have right now. It will continue to include testing the kind of people you see now, the healthcare workers, people who think they may have COVID-19. But in addition to that, there will be additional tests run throughout the entire county so we can get a better feel for where the exposure may be, and a better ability to contain it so that it doesn't spread rampantly across the county. Be assured of this. More announcements are coming about massive increases in testing across Dallas County.
Okay, we'll look forward to that. So, Governor, let me ask you about property taxes. One of the biggest questions we've had in recent days, especially, a lot of people feel if the normal process is allowed to play out, it could be a mess with people trying to protest, and we're trying to get through the whole COVID situation. Will you freeze property valuations at 2019 levels and allow that to happen through 2020?
You know, all those legal issues have to be looked at. I saw an opinion come out of the Attorney General's office, I think it was today or yesterday, on a property tax-based issue. I need to go back and look at that and see what it said and see how it would impact that decision-making process.
Okay. Kids going back to schools, let's talk about that. You indicated earlier in this week, and we reported here, that hopefully a decision on that is going to be made by the end of this week. Have you made a decision? Are you ready to share?
I'll be sharing that decision about schools and the future of the school year on Friday when I make my announcement.
Okay. Well, we'll look forward to the announcement on Friday. As we stand right now, here middle of the week, how would you describe the state of the state as far as COVID-19, Texas response, and what we can do to help ourselves?
I'll tell you three things. First, if you want to see the glimmers of hope, you look at the degree of the angle of the increase in the number of cases. And over the past week, it's gone from 13 to 12 to 11 to 10, now to 9-degree angle. And so that decrease in the angle number shows that we are leveling off. The Dallas County number looks good. The surrounding county areas, they look good. The curve hasn't bent yet, but it's getting very close to being bent. So progress is being made. The second thing that we need to emphasize, however, and that is, if we are going to be able to get back to work, people have to continue this process of distancing practices, good hygiene practices, making sure we do not spread the coronavirus to others, because there still is no medicine that can be taken for it, still no immunization for it. If we do begin to open back up a little bit, we must maintain practices that prevent people from spreading coronavirus from one person to another.
And Governor, the last question for you, what is your sense from where you sit and all the information that you take in on when a sense of whatever our new normal is going to be? Do you sense after the summer months? Do you sense into the fall? I can't imagine you sense any time before that.
Well, real normal will be when the immunization comes out, and that probably will be about a year from now. Before that, there will be medicine treatment to anybody who tests positive for COVID-19, and those are called therapeutic pharmaceutical drugs, whether it be by injection or by pill, and that should be available this summer, so that people who do contract COVID-19 will have a treatment they can receive where they shouldn't be facing these dire consequences that we see some people suffer through in the hospital room. So what we need to do is we need to bridge the time period from now until the time that the therapeutic drugs become available. Therapeutics will not be an immunization. However, they will provide greater ability for people to engage in things like the workforce.
And I said last question, and I'll pardon myself on that. One last one. I spoke at great length the other day with Ed Cerna, who runs the Texas Workforce Commission. Talk to me about the reality of the problems on their end of things. So many people piling in, trying to receive their unemployment benefits. So many people still can't get through. Part of the reason, outdated computer systems to a degree, and also no one could have anticipated the amount of people trying to call. What's the state doing to help the Texas Workforce Commission to get these people money in their hands so they can pay their bills?
We've provided the Workforce Commission with hundreds upon hundreds of additional staffers. They've gone to 7-day-a-week work week, and they have begun the process of really turning these around a whole lot faster. As we speak right now, more than 1.24 million people have had their unemployment benefits paid, and they've paid out now almost $500 million in unemployment benefits. They're not caught up yet, but they are getting there very rapidly.
Governor Greg Abbott, you're kind once again to let our viewers hear from you directly, and we appreciate you being with us tonight. You're Governor of the state of Texas, Greg Abbott. Thank you.